Irritable bowel syndrome, or IBS, is a common chronic disorder marked by abdominal pain and altered bowel habits, with causes ranging from microbiome changes to psychosocial factors. Despite affecting 10 to 15% of people, relatively few patients use FDA-approved treatments, of which there are several for IBS-C for constipation and IBS-D for diarrhea. Additionally, some publications advocate for the use of other medication classes, such as antidepressants and antispasmodics, to address various symptoms of IBS. But what is the long-term safety of these recommended pharmacotherapies? In this study, we evaluate a large nationwide electronic health record, or EHR, to assess the all-cause mortality associated with recommended medication classes for IBS or its subtypes in patients with IBS. Using TriNetX analytics, our analysis utilized aggregated EHRs from 142.9 million patients. 669,083 patients with IBS met the inclusion criteria. We matched each patient based on 56 factors to enable fair comparisons. And here are the results. Antidepressant use was associated with increased all-cause mortality. Patients with IBS who were prescribed antidepressants experienced a significantly higher incidence of secondary outcomes compared to those not on antidepressants, including hypertension, cardiac arrhythmia, inpatient encounters, heart failure, ischemic heart disease, aspiration pneumonitis, falls, stroke, serotonin syndrome, suicidal ideation, gastrointestinal bleeding, and obesity. Antispasmodic use showed no increased mortality risk. In patients with IBS-C, antidepressants demonstrated a significantly increased mortality risk. However, all-cause mortality rates were not significantly increased in patients using PEG 3350, secretagogues, or antispasmodics. In patients with IBS-D, elevated mortality risks were seen in patients taking antidepressants, diphenoxylate, and loperamide. All-cause mortality rates were not elevated in patients taking cholestyramine, cholestyramine, or elaxatilene, rifaximin, or antispasmodics. In summary, antidepressant use is associated with an increased risk of all-cause mortality in patients with IBS, even when broken up into IBS-C and IBS-D subclasses. For IBS-D, diphenoxylate and loperamide are associated with increased mortality risk in addition to antidepressants. Although this does not prove causation, this study highlights the importance of further research to elucidate underlying mechanisms and guide safer, evidence-based treatment strategies.